If your doctor recently told you that your blood sugar is running a little high, or if you're already managing type 2 diabetes or pre-diabetes, I want you to take a breath. Because what I'm about to share with you could genuinely change what you put on your plate starting today. I'm Dr. Leonid Kim, and on this channel we focus exclusively on health strategies for people over 60, backed by real science, not internet myths. In this video, I'm going to walk you through the top 10 foods proven by clinical research to lower blood sugar, fast, without relying on medications. And every single one of them is sitting right there at your local grocery store. Now, I do want to flag something before we dive in. Number 3 on this list surprises nearly every patient I share it with. In fact, most seniors over 60 have been avoiding this food completely, and that's actually making their blood sugar worse. So make sure you stay for that one. Let's get into it. First, let's spend just 2 minutes understanding why blood sugar becomes a problem after 60. Because once you understand the why, the foods I'm about to recommend will make perfect sense. Here's what's happening inside your body. Number 1, insulin resistance increases with age. As we get older, our muscle mass naturally declines, a process called sarcopenia. And here's the thing, muscle is your body's primary storage unit for glucose. Less muscle means your cells become less efficient at pulling sugar out of your bloodstream when insulin signals them to. That sugar has nowhere to go. It stays in your blood. Number 2, your pancreas slows down. After 60, the beta cells in your pancreas, the ones that produce insulin, start working less efficiently. So not only are your cells not responding well to insulin, you're also producing less of it. Number 3, lifestyle and stress pile on. Most people become more sedentary after retirement. Combine that with elevated cortisol, the stress hormone, and you have a recipe for blood sugar that keeps creeping upward year after year. Now, here's the most important thing I want you to hear today. This is not your fault. And it is absolutely something you can address, starting with food. The foods I'm about to share work by directly targeting these 3 mechanisms. They improve how your cells respond to insulin. They slow down how fast glucose enters your bloodstream. And some of them directly support your pancreas in doing its job. Alright, let's get to the list. We're going from number 10 down to the number 1 most powerful food on this list. Coming in at number 10, cinnamon. And yes, this is the actual spice you already have in your kitchen cabinet. Here's the science. Cinnamon contains a compound called cinnamaldehyde, which has been shown in multiple studies to mimic the action of insulin at the cellular level, meaning it helps your cells absorb glucose even when insulin signaling is impaired. A 2003 study published in Diabetes Care found that just half a teaspoon of cinnamon per day reduced fasting blood sugar by up to 29% in people with type 2 diabetes over 40 days. Now, an important note for seniors. There are 2 types of cinnamon at the grocery store. You want Ceylon cinnamon, sometimes labeled true cinnamon. The more common cassia cinnamon contains a compound called coumarin, which in high doses can affect liver function. Ceylon cinnamon has far less of this and is the safer long-term choice. How to use it. Half a teaspoon daily. Stir it into your morning oatmeal, add it to your coffee, or mix it into plain yogurt. Easy. Apple cider vinegar has been used as a folk remedy for centuries, but what does the actual research say? A lot, actually. The key compound is acetic acid, which works in 2 important ways. First, it slows down the enzyme that breaks down starch in your digestive tract, meaning carbohydrates are digested more slowly and glucose enters your bloodstream more gradually. Second, it improves how efficiently your muscles absorb glucose after a meal. A study in the journal Diabetes Care showed that taking apple cider vinegar before a high-carb meal reduced post-meal blood sugar spikes by 34%. How to use it. 1 to 2 tablespoons diluted in a large glass of water, taken 15 minutes before your biggest meal of the day. Never drink it straight. It's highly acidic and can damage tooth enamel and irritate the esophagus. And if you have a history of acid reflux or stomach ulcers, check with your doctor first. Chia seeds are small, but their effect on blood sugar is anything but. When chia seeds come into contact with liquid, they form a thick gel. This gel physically slows down the movement of food through your digestive tract, which means glucose is released into your bloodstream more slowly and evenly, preventing those sharp after-meal spikes. 2 tablespoons of chia seeds contain 10 grams of fiber, most of which is the soluble kind that directly impacts glucose absorption. A 2017 study in Nutrients found that chia seed consumption significantly reduced post-meal blood sugar in people with type 2 diabetes. How to use it. 2 tablespoons per day. Stir them into yogurt, add them to a smoothie, or mix them into oatmeal the night before and let them soak. They have almost no taste on their own, so you won't even notice them. If you've been avoiding fruit because of the sugar content, I understand. But berries are a very different story from other fruits, and I want you to really hear this. Berries are packed with anthocyanins, the pigments that give them their deep blue, red, and purple colors. These compounds have been shown in research to improve insulin sensitivity and reduce inflammatory markers associated with type 2 diabetes. Crucially, berries have a very low glycemic index. Blueberries clock in at a GI of around 53. Strawberries are even lower at around 41. By comparison, a slice of white bread is 75. A large study from Harvard, published in BMJ, found that people who ate the most blueberries had a 26% lower risk of developing type 2 diabetes than those who ate the least. How to use it. Half a cup per day. Fresh or frozen. Frozen berries retain virtually all their nutritional value, are available year-round, and are significantly cheaper. Add them to oatmeal, yogurt, or eat them as a snack. Leafy green vegetables deserve a spot on every single blood sugar management list, and here's why. First, they are extremely low in digestible carbohydrates, meaning they have almost no direct impact on blood sugar levels. But more importantly, leafy greens are rich in magnesium. This mineral is essential for insulin signaling. In fact, research shows that people with type 2 diabetes are significantly more likely to be deficient in magnesium than those without. Every cell in your body needs magnesium to properly respond to insulin. Greens like kale also contain alpha-lipoic acid, an antioxidant that has been shown to improve insulin sensitivity and reduce oxidative stress in people with diabetes. How to use it. Aim for at least 2 packed cups of leafy greens per day. Sauté spinach in a little olive oil with garlic. Add kale to soups or stews. A handful of spinach in a morning omelet is completely undetectable. Your grandchildren won't even know it's there. Real quick, if you're getting value from this video, go ahead and tap the thumbs up button right now. It genuinely helps us reach more seniors who need this information, and it takes you all of 2 seconds. And if you haven't subscribed yet, please do. We post every single Tuesday, and next week's video on the #1 breakfast that absolutely wrecks your blood sugar is one you do not want to miss. Now, here's where it gets really good. Our top 5 are coming up, and #1 has over 47 clinical studies supporting it. Let's keep going. Avocado at number 5, And this is one that people are often surprised to see on a blood sugar list, because avocados are high in fat, but that's exactly why they work. The fat in avocados is primarily monounsaturated fat, specifically oleic acid, the same healthy fat found in olive oil. Here's what that does for your blood sugar. Fat significantly slows down the rate at which your stomach empties after a meal. When your stomach empties more slowly, glucose enters your bloodstream more gradually, and you avoid the sharp spike and crash cycle. A 2019 study in the Journal of Nutrition found that adding half an avocado to a standard lunch reduced post-meal insulin and glucose levels compared to the same meal without it. On top of that, one avocado contains around 10 grams of fiber, another major tool for blood sugar control. For seniors specifically, avocados are also a rich source of potassium and heart-healthy fats, two things that become increasingly important as we age, since cardiovascular risk and blood sugar issues often go hand in hand. How to use it. Half an avocado per day. On whole grain toast in the morning, sliced alongside eggs, or mashed into a simple guacamole with lunch. Affordable, filling, and your blood sugar will thank you. Number 4 is fatty fish, and this one is particularly important for people over 60. Fatty fish like salmon, sardines, and mackerel are among the best sources of long-chain omega-3 fatty acids, EPA and DHA. And here's what those do. They reduce systemic inflammation. Why does that matter for blood sugar? Because chronic low-grade inflammation is one of the primary drivers of insulin resistance. When inflammation goes down, insulin starts working better. A meta-analysis published in Diabetes and Metabolism found that regular omega-3 consumption was associated with significantly improved insulin sensitivity and reduced inflammatory markers in people with type 2 diabetes. There's also an important cardiovascular angle here. After 60, the combination of elevated blood sugar and cardiovascular risk can be a serious concern. Fatty fish addresses both simultaneously. How to use it. 2 to 3 servings per week. A serving is about 4 ounces, roughly the size of your palm. Grilled, baked, or even canned salmon and sardines are extremely affordable and retain all the omega-3 benefits. Don't overthink it. Alright, this is the one I promised you at the beginning. Number 3. And I'm willing to bet a good portion of you watching right now have been avoiding eggs, or at least cutting back on them because of concerns about cholesterol. I hear this from my patients constantly. Dr. Kim, my cardiologist told me to watch my eggs. Let me give you the most current science on this because the landscape has changed significantly. The idea that dietary cholesterol from eggs directly raises cardiovascular risk has been largely revised by modern research. For most healthy people, the cholesterol you eat has a minimal impact on your blood cholesterol levels. Your liver compensates by producing less. The American Heart Association updated its guidance on this years ago. Now, here is what eggs actually do for your blood sugar. Eggs are one of the highest quality complete protein sources available. When you eat protein, especially at breakfast, it significantly slows gastric emptying and reduces the glycemic impact of the carbohydrates you eat alongside it. In practical terms, 2 eggs at breakfast means your blood sugar rises more slowly, peaks lower, and stays stable longer throughout the morning. A study in the American Journal of Clinical Nutrition found that a high egg breakfast improved blood sugar control and reduced appetite throughout the day in people with type 2 diabetes. How to use it. 2 whole eggs per day is considered safe for most people without underlying lipid disorders, and your doctor can advise based on your specific blood work. Scrambled, poached, hard-boiled, all are excellent options. Pair them with spinach and avocado, and you've just combined 3 items from this list into one powerful breakfast. Number 2 on our list, legumes. Lentils, black beans, kidney beans, chickpeas. And these might be the most underrated blood sugar food in the entire American diet. Here's why legumes are so remarkable. They have an extraordinarily low glycemic index. Lentils have a GI of around 29, black beans around 30. For context, white rice has a GI of around 72. That difference is enormous. What drives that low GI? 2 things working together: soluble fiber and plant protein. The soluble fiber in legumes forms a gel in your digestive system, just like chia seeds, slowing glucose absorption. The protein simultaneously blunts the insulin response. Together, they create one of the most effective blood sugar stabilizing combinations in any whole food. A landmark study in JAMA Internal Medicine found that substituting legumes for other carbohydrate sources significantly reduced hemoglobin A1C levels. That's your 3-month blood sugar average in people with type 2 diabetes. And for seniors on a budget, this matters. Dried or canned lentils and beans are among the cheapest foods at any American grocery store. A bag of dried lentils costs less than $2 and makes a week's worth of servings. How to use it? Half a cup of cooked legumes per day. Add lentils to soups, stews, or eat them as a simple side dish. Toss black beans into a salad. Make a hearty chili on Sunday. Accessible, affordable, and genuinely powerful. And the number 1 food on our list, with more clinical evidence behind it than arguably any other single food for blood sugar control, is steel-cut oats. Not instant oats, not the flavored packets with added sugar. I mean real, whole, steel-cut or rolled oats. Here's what makes oats categorically different from every other carbohydrate on the market. Oats contain a unique type of soluble fiber called beta-glucan. This isn't just any fiber. It's been the subject of over 47 clinical trials specifically examining its effects on blood sugar and cholesterol. Here's what the research consistently shows. Beta-glucan forms a thick, viscous gel in your gastrointestinal tract. This gel physically slows gastric emptying. It coats the intestinal wall and slows glucose absorption. The result? A dramatically flattened glucose curve after eating. Studies have shown that a single bowl of steel-cut oats can reduce the post-meal blood sugar spike by 30 to 40% compared to equivalent calorie carbohydrates. The FDA has actually approved a health claim for oat beta-glucan and its role in reducing the risk of cardiovascular disease. That's how strong the evidence is. On top of all of this, beta-glucan feeds the beneficial bacteria in your gut, and emerging research is showing a strong connection between gut microbiome health and blood sugar regulation. Why steel-cut specifically? Steel-cut oats have a lower glycemic index than rolled oats, and significantly lower than instant oats, because the grain structure is still largely intact, meaning it takes your body longer to break it down. How to use it? Half a cup of dry steel-cut oats cooked with water or unsweetened almond milk. Prep it the night before in your slow cooker. Top with blueberries from number 7 and a half teaspoon of cinnamon from number 10, and you just built the single most blood sugar friendly breakfast on this planet. I have recommended this combination to hundreds of patients over 60, and the results I've seen in their 90-day A1C numbers never get old. Before I wrap up, I want to give you one more tool that isn't a food. It's a strategy, and it costs absolutely nothing. Tip number 1, eat in the right order. A landmark study from Cornell University showed that the sequence in which you eat your food at a meal has a measurable impact on blood sugar. The order that produces the lowest glucose spike is vegetables first, then protein, then carbohydrates last. Why? Because fiber and protein eaten first create a kind of biological buffer in your stomach that dramatically slows how fast the carbohydrates that follow are digested and absorbed. Done consistently, this single habit has been shown to reduce post-meal blood sugar spikes by up to 36%. No change in what you eat, just when within the meal. Tip number 2. Take a 10-minute walk after eating. Your leg muscles, the largest muscles in your body, act like a sponge for glucose when they're active. A short 10-minute walk after a meal is clinically shown to reduce post-meal blood sugar more effectively than the same walk taken before eating. These two habits, combined with the 10 foods on this list, that is a genuinely powerful, medication-free strategy. Let me quickly run through all 10 one more time. Number 10, cinnamon. Number 9, apple cider vinegar. Number 8, chia seeds. Number 7, berries. Number 6, leafy greens. Number 5, avocado. Number 4, fatty fish. Number 3, eggs. Number 2, legumes. And number 1, steel-cut oats. Here's what I want to leave you with today. You don't need a prescription to take control of your blood sugar. You need a grocery list. Start with just 2 or 3 of these foods this week. Build from there. And watch what happens to how you feel, your energy, your focus, your sleep. As always, please talk to your doctor before making major dietary changes, especially if you are currently on blood sugar or diabetes medications. These foods are powerful, and that means they can actually interact with your current treatment in ways your doctor needs to know about. If this video helped you, leave me a comment below telling me which food surprised you most. I read every single one. New video this Tuesday. I'll see you then.